In a quest to combat and totally eradicate the COVID-19 pandemic that has befallen Nigeria as a nation, vaccination and campaigns have been ongoing to inform and propagate the need for Nigerians to be vaccinated. The National Primary Healthcare Development Agency, at a press conference held in Abuja on 25th May 2021, gave updates on the status of COVID-19 vaccination process ongoing in the country. Coming from the Executive Director of the NPHCDA, he is pleased to announce to Nigerians that the administration of the first doses of the vaccine included in the campaign as of 24th May is almost coming to an end, with about a total of 1,929,237 Nigerians have been vaccinated, representing 96% of the targeted population. Further stating that the second doses administration has begun and has reached a number of 4,683 recipients. Individuals currently eligible for the second dose will have received their first dose 6 to 12 weeks ago, thereby advising Nigerians to note the date for the second dose issued on their cards to gain full protection against COVID-19 virus.
Those individuals currently eligible for second doses will have received their first dose 6 to 12 weeks ago. We are advising that all Nigerians who have received their first dose should check their vaccination cards for the date of their second dose and ensure that they receive the second dose to gain full protection against COVID-19. As we transition to administering second doses, our teams have assessed the communication and mobilization activities that have been undertaken thus far to create awareness on the COVID-19 vaccine and encourage uptake. We'll be building on the work we've already done in these areas to ensure that Nigerians can easily access accurate information about COVID-19 vaccination. Our goal is to do everything possible to educate, combat misinformation, and ensure confidence in the safety and effectiveness of vaccines, and to ensure that all Nigerians have clear information on how, where, and when to get the vaccine.
Country representatives from the World Health Organization, Dr. Walter Mulumbo, and from the UNICEF, Mr. Peter Hawkins, spoke further on the success contribution made so far during the campaign, and also called on governors, traditional and religious leaders to help propagate and campaign on the need for vaccination.
We cannot underestimate the steps that have been taken, but also the challenges ahead of us. What has significantly taken place is, with the first doses, is that for a majority of frontline staff, especially the health staff, they have been protected with the first dose. As the Executive Director has said, the second dose vaccine has already started, and in many of states it will continue over the next 5 to 6 weeks.
According to the Executive Director NPHCDA, Dr. Farouk Shuaibu, the federal government is taking significant precautions to protect Nigerians against the Indian variants of the virus, as flights from India and other high-risk countries such as Turkey and Brazil have been barred from entering the country.
For the Northeast, this is scheduled for the 8th of June in Yola, Adamawa State. For the South-South Zonal Town Hall meeting, it is scheduled for the 15th of June 2020 in Benin, Edo State. The Southwest Zonal Town meeting is scheduled for the 22nd of June 2021 in Lagos, Lagos State. The Northwest Town Hall meeting is scheduled for the 29th of June 2021 in Kano, Kano State. The last Town Hall meeting in the Southeast is scheduled for Owerri in Imo State on the 6th of July 2021. The federal government is taking significant precautions to protect Nigerians against the B1617 variant, also known as the Indian variant of COVID-19 virus. Flights from India and other high-risk countries such as Turkey and Brazil have already been barred from entering Nigeria. We're ramping up our tests and trace measures, and we're accelerating the national project to establish production of oxygen supplies all across the states of Nigeria in collaboration with the Federal Ministry of Health and the NCDC.
Zainab Ahmed, Voice TV, Nigeria.